Hi, I'm Dr. Jordan Sand, a double board certified facial plastic surgeon, and we're going to be talking a little bit about eyelid anatomy and what we look for and options might be available for this particular patient. Looking at the eyelid anatomy, a lot of patients come to us complaining of feeling tired, feeling that their eyes express that tiredness and wanting to look more refreshed. Even when they get a full night's sleep, their eyes still feel like they're displaying a tired kind of look. There are a variety of options that are available for augmenting the brow, augmenting the upper eyelid or the lower eyelid, and these things would just depend on the person's anatomy and what the best options would be. So when we're first assessing that area, I typically start kind of from the top down and usually assess where the brow is located. And so the brow itself has a fat pad, and for women, we like that fat pad to sit just right above the orbital rim. And so for this patient, her orbital rim sits just right there. And so the fat pad sits right above the orbital rim. So that's sort of the ideal location. For some patients, that brow starts to droop and then it kind of starts to impede the orbital rim and this kind of fissure here. And that, basically crowds the upper orbit and can create some fullness there, which then makes the eye look a bit tired. And in those situations, we'll do kind of a tail brow lift, which can be done in several different ways. We can do a suture lift to help pull that up. We can do an excisional lift where we kind of work back here in the hairline and release some of these ligaments in order to provide just a little bit more lift there. I would not recommend that in this situation. I think the brow is in great location. For a lot of patients, the need for a brow lift has been diminished by the use of Botox. And so the forehead and around the eyes doesn't tend to age at the same rate as the other parts of the face for a lot of our patients that are using Botox. And so the need for a brow lift has definitely decreased, I've seen in the last kind of 10 to 15 years. So the next thing we look at is the upper eyelid and what the contour of the upper eyelid is. For this patient, she has just a little tiny bit of skin fold in there. Go ahead and close your eyes here for a second. That skin is pretty tight. When she opens up her eyes, there is just a little double fold right in there instead of that kind of nice crisp upper eyelid sort of crease. And so there are a variety of ways to work on the upper eyelid. Sometimes if there's just a little ripple of skin, you can do just a little laser on the upper eyelid to kind of tighten that skin up just a little bit. The volume of the upper eyelid also is a very important thing to be looking at. For this patient, her eyelid volume, I think, is ideal. There's fullness in the upper eyelid, doesn't look hollowed out. There isn't exuberance of the fat pads of the upper eyelid, which often happens for the medial aspect of the upper eyelid and would require sometimes a fat transposition or potentially a tiny cauterization or excision of that fat in order to help improve that upper eyelid contour. For the lower eyelid, we're looking at several different things. We're looking at the skin quality and texture. We're looking at the volumetrics of the lower eyelid. We're also looking at lower eyelid position and how that relates to the iris, whether the eyelid is rotated outward or inward, whether it's retracted, and how the lower eyelid skin is, how tight that is, and whether there's kind of fine lines there. For this patient, her orbital volume is quite good. There's maybe a slight depression in the medial aspect of the lower orbit. The skin quality is also great. There's some just very fine lines that you can see and detect. There's not a lot of skin excess there. Her eyelid position is great, kind of sitting right at the lower point of the iris. For the little, very micro volume depression there, usually an option that we can use in that case would be PRP. That's where we draw blood and get the growth factors, and then we can inject it into the lower eyelid. What that does is it kind of thickens the collagen of the skin there, and it deposits just a little bit of some volume to the lower eyelid, and that can help, kind of fill that out just a little bit. I would say it's very mild in this case. Filler to the lower eyelid, I'm extremely cautious about. I don't do a lot of filler to the lower eyelid. I sort of try to avoid that, just because there's a lot of complications from filler to the lower eyelid, whether it be migration or bumpiness to the lower eyelid. The filler certainly dissolves a lot of kind of poorly placed filler in the lower eyelid has been sent to me for evaluation. For the skin quality, a laser is typically what we recommend. We have a Erbium laser here in the office, and that's, I think, probably the best option for the lower eyelid as far as skin tightening and texture improvement. So I think looking at the upper eyelid skin and the lower eyelid skin with that little pleat and then just a little bit of some mild skin texture kind of area below, probably a periorbital laser would be the best option for rejuvenation in this situation. I don't think that I would do anything for the brow. As I mentioned before, I think that's an excellent location. So thank you very much. This is us talking a little bit about periorbital anatomy and then options that are available for treating those areas.